So now we've had a global perspective from Dr. Coley and Dr. Quancum. We're moved to a country perspective, and the first of those is clinical engineer Pedro Galván, who has been in the Ministry of Health Paraguay for several years, and they implemented telemedicine, telehealth several years ago. So we're seeing sort of an advanced case of what you can do with these tools there, and then followed by Adrian Pacheco from Ministry of Health Mexico, Cenotech, and how they're developing their telehealth program in Mexico. Take it away, Pedro.
Thank you, Tom, for the invitation to participate at this webinar. I will try to give you an overview how telemedicine experience using artificial intelligence for COVID-19 diagnosis can help and is helping as clinical engineering influencing telehealth. Next, please. Our team is composed of a multidisciplinary group where you can find biomedical, clinical engineers, physicians, informatics, and pneumologists. Next, please. Creative use of artificial intelligence, machine learning, information and communication technology, as well medical devices offers, as you know, many opportunities how you can enhance the healthcare during the current COVID-19 pandemic in many countries around the world. One of the challenges for clinical and biomedical engineers, physicians, and medical informatics is to develop AI systems to enhance the global health. Populations, as you know, living in low-setting countries did not have access to specialized care and quality diagnosis services like RT-PCR for COVID-19, and thus depend on the scarce resources of their health system. Inside such countries don't exist equity between urban and rural populations. In this context, the automated AI system for COVID-19 diagnosis based on telemedicine platform should be directed toward alleviating the current lack of highly trained radiologists to perform diagnosis of CT imaging at the district and regional hospitals countrywide and serve as triage to rationalize RT, PCR, and human resources in low-setting countries. The utility of such automated AI system for COVID-19 diagnosis to mitigate the situation challenge was investigated in this case. Next, please. Regarding the methods, this was a descriptive study carried out by the telemedicine unit of the Ministry of Health of Paraguay in collaboration with the Department of Biomedical Engineering and Imaging of the Health Science Research Institute and the University of the Basque Country to evaluate the utility of the automated AI system based on telemedicine platform for COVID-19 diagnosis. The results divided in 4 likelihood levels for COVID. That means low, medium, high, and severe level was obtained by the tailored AI system implemented in 14 public countryside community hospitals, where we analyzed comparing clinical characteristics and imaging features. The goal of our project was to explore the utility of automated AI system based on telemedicine platform for COVID-19 diagnosis, to expand the role of chest X-ray imaging using computer tomography in diagnosing and assessing coronavirus infection, so that it can be more than just a screening tool for signs of COVID in patients' lungs. Next, please. Here you can see the operation schema of our implemented system. On the left, you can see how a chest CT imaging will process through the AI system involved in a cloud. And of the right side, you can see how are our CT devices spread countrywide. The next, please. As results, we can say we have 430 remote diagnoses and screening were performed between March and August 2020 in 14 district, regional, and specialized lung hospitals across the country. 62.6% correspond to male, as you know in the world is the same average, and 37.4% to female. The average age of the patients was 50.7 years. The majority of the COVID-19 patients, that means 59%, were young and in the interval of 19 to 59 years old. Both used AI systems have different background information. That means fusing molecular, clinical, epidemiological, and imaging data to detect COVID-19. Such a system, that means the AI system, learned from abnormalities to arrive at a diagnosis on its own. That is very important to remember, because that is the reason because we found the difference between two different implemented AI systems. At this picture, you can see the age group distribution of diagnosed patients for COVID-19. As you can see, most of the people were between 19 and 59 years old. Next, please. The diagnosis of the two tailored AI systems implemented in 14 public countryside community hospitals were analyzed comparing clinical characteristics and imaging features. 4 likelihood levels for COVID, that means low, medium, high, and severe, were determined through the two AI systems. The comparability difference between the two AI diagnoses was 19% for low, 65% for medium, 53% for high, and 64% for severe level. As you can remember, the difference is to find in the learn process of both AI system with information regarding patients with COVID-19 diagnosis. At this picture, you can see the comparison of likelihood levels for COVID-19 diagnosis. As you can see on the left, most of the people were in the level of 0 to 25%. That's because we have catch all our patients at the beginning of the disease of COVID-19 maybe. And on the right, you can see how many people from each group were evolving and having maybe the infection in the lung. Next, please. The most common findings evaluating clinical characteristics and imaging features of COVID-19 on sequential chest CT examinations were severe pneumonia, bilateral pneumonia with pleural effusions, bilateral pulmonary emphysema, diffuse ground glass opacity, paresis of hemidiaphragm, calcified granuloma in lid, sequelae of TB, bilateral emphysematous and fibrotic changes, and traction bronchiectasis. Next, please. At this picture, you can see the most common findings in the low likelihood level for COVID. That means the distribution of type and number of pathologies diagnosed by the pneumologists and imaging specialists and at distance. And as you can see, this is the group where you can find the majority of the patients. That is between 0 and 25% of probability to have COVID at the beginning of the illness. You can see that most of the people, of the patients, were to evaluate by pneumologists because it was not clear for the AI system to make a diagnosis regarding COVID. The second group was the pathologies of another etiology. That means that was not correctly to diagnose COVID from the pictures, from the X-ray chest imaging. The third group was normal, and the fourth group was viral lung diseases of another etiology. Next, please. Now, an important cost reduction, that means patients' displacement, RT-PCR and human resources, was obtained through the automated AI system for COVID diagnosis. Another result was the more important role of CT, and that is to highlight right now, was in finding lesions and evaluating the effects of treatment for the physicians. That is the finding of the pneumologist. AI-enhanced telemedicine tool can perform a risk stratification of patients. It's very important in 4 levels. Why? To decide which type of care they need based on the predicted course of their COVID infection. That is another very important finding for the pneumologists and for the ICU physicians, in order to not to collapse the hospitals countrywide. And the last result was determined AI sensitivity for COVID-19 was 93%. That was obtained comparing AI system diagnosis versus RT-PCR in lab. The next, please. And according to our findings, in conclusion, AI technology based on a telemedicine system could help to develop a diagnosis platform for COVID-19 and other respiratory pathologies that enhance the capabilities of medical imaging diagnosis at countryside hospitals, as well as speeding the delivery of chest image diagnosis for suspected patients during COVID-19 pandemic. And very important, rationalizing scarce RT-PCR and specialized human resources in low-setting countries like Paraguay. As you see, we are implementing all what Junkap and Manish have said regarding the technology to show you how clinical and biomedical engineers in a very important research group, multidisciplinary, with another specialized people like physicians, informatics, and ICU people, pneumologists, can help the world to give the opportunity as technologists to give the solution for this pandemic. Thank you very much for your attention. I'm open to your question.
Thank you, Pedro. Please put your questions in the Q&A tab or possibly through chat, and we'll move on to Adrian